Each week I run a community meeting where the patients can come and meet with me in the lounge. It gives them a voice in terms of new things we're thinking of starting on the unit. They can give positive and negative feedback, and we'll try and resolve as much as possible. So it's a constant looking for improvement exercise. One time we had this woman, she had this obsession with her skin where she kept thinking that there was something wrong with it. She couldn't get it clean enough and she was scrubbing it raw. I brought her some cream and some cleanser. I just washed her face for her and put the cream on. And then about 8 months later, I ran into her and I didn't even recognize her. She was so put together and so articulate. She just kept saying like that was such a wonderful thing you did. That was just so caring. So even when people are at their most ill, sometimes they remember the simplest kindnesses. I think excellence is making sure that you're using a gold standard of care, but you're also striving for the best in staff morale, staff safety, as well as give the best of yourself.
So we are a branch of the main hospital in Queensway. They are the patients who have kidney failure. So each patient, they have prescribed hours of dialysis. Some of them, they come 4 hours, 3 times a week. Some are 5 times a week. You can know all their birthdays, their anniversaries. So it's like we are brothers and sisters here. One of these patients, I have to explain to him in a simple term that the patient can understand. Dialysis cleans your toxic waste in the blood. It's the same as with the car. When you change oil, of course, you will have good running engine. You don't hear any noise. When the patient heard that, he understood. So I said, okay, you have to try this for a week and then tell me what happened. Then he come to me and then he said, Techi, you are right. I feel more better. It's my obligation as a nurse to provide quality care to my patient. The result is they are satisfied. They can manage their health well.
I would see patients during the day and just do a lot of counseling as well as manage any of their medical concerns. And a lot of my patients come for alcohol problems, opiate use disorder, a range of substance use, but obviously mental health kind of comes together with that. When people think about addictions, there's a tendency to sort of think of a stereotype, but in fact, it is a wide range. And we don't often see that portrayed in the media as such. Really trying to identify and walk in their shoes, and from that perspective it kind of adds that sort of human quality to something that can become very clinical, I think. I've been in a situation where a patient has said that's the first time I've ever told somebody about the abuse I went through or the trauma, and that to me says a lot, because for someone to do that they have to feel really safe to do so and also feel like they will be believed. I feel that they are a very vulnerable population as well as sort of misunderstood. I feel like it's a real blessing for me to use the training that I have to work with them and walk alongside their journey in their recovery.
Depending on the day, you're looking at about 2 to 3 ortho OR rooms that I'm overseeing. I do a lot of hands-on direct patient care, but I also work behind the scenes, just ensuring that every ortho case that comes into the OR is prepared and ready before the patient even enters the room. It provides the nursing team to have all their attention, all their focus on patient care. I'm constantly collaborating with different disciplines in the OR, whether it be surgeons, anesthesia, even MDRD, which reprocesses our instruments, ensures that my patients are given the best care, ensures that all the parts that go into the surgery are working efficiently and effectively. What I like most about my job is the positive impact I think I have on my patients. Orthopedic surgery is fascinating to me. I work as part of a team that brings back a patient's mobility. I constantly strive to lead by example. I want to be that colleague that people can rely on. Excellence to me, it means going above and beyond, and that constant motivation to change or to improve the surgical process.
It's so funny because often we work with people for such a short amount of time, but I find that it's almost like the barriers have been knocked down and we get to know people quite intimately, quite quickly, and their families as well, which I think is quite special in palliative care. I worked with a patient and he had 2 sons and they weren't very close, but now all of a sudden they're both at the bedside in the hospital room with their father, navigating this new experience for everyone, and it brings people together. We don't talk a lot about death in our society, and we know it's a universal thing. It's an opportunity to do education around death and to try to normalize it so that in the future, when they have another death experience, they've gotten some tools to deal with it and process it a bit better. I find in palliative care, we get the opportunity to really hear from the patients what is truly important for them at this time of life. And a lot of that I find is honoring their dignity and their goals and learning about their values to preserve that dignity during a time in their life where they may be losing a lot of things.
We work in partnership with the police in going out and helping people who are in mental health crisis. It can range from children to senior citizens. So when I come in during the day, I am working with the officer and we're looking at what calls come in through 911. The police are responding to the call. We are then evaluating whether it's an appropriate call for us to go to. And our role can be helping also the family and the person in crisis. A particular story that comes to mind is the time that I was in a grocery store and someone was staring at me. They eventually walked over to me and said, "You came to my home and you helped me," and how we treated them with respect and professionalism. That someone months and months later still has that impression is really why you do the work the way you do it. Helping them maintain their life in the community, that to me is the epitome of community service.